Morning, we're continuing our Breast Cancer Awareness Month series with IU Health Arnett physicians. Today's topic is radiation options, and joining us now with more on radiation options is radiation oncologist Dr. Matt Orton. Thanks for coming in this morning.
Thank you, Alex, for having me.
So tell us a little bit about when you know that treatment or radiation treatment is right for someone who has breast cancer.
So the good news is for the vast majority of women with improved mammograms, we're discovering a lot of early stage breast cancer. And for women with early stage breast cancer, radiation therapy is nearly always an option for those who wish to do what we call breast conservation therapy or try to avoid having to have the entire breast removed. We know this has significant benefits for social as well as psychosocial health of women as well.
And we've talked about that prevention and checking so far in our series. We've also talked about the surgical option as well, but this is obviously a lot better for them with how they deal with other people, just the way that they see themselves and probably how they think they're doing about the disease. So tell me, what options are available for women within radiation?
So over the last several decades, there's been a trend in radiation to try to make treatments a little bit more convenient for women in terms of shortening the length of treatment. Advanced technology has also allowed us to be able to be more conformal or deliver radiation to smaller areas and still give us very good results. So there's a lot of exciting things that have happened to allow most women to undergo more convenient treatments, requiring now only as little as 3 to 4 weeks, as little as 1 week for some, compared to 6-7 weeks that they used to have to do even a decade ago.
Now, for some people, radiation is a toxic word. You know, it's not always a good word to use, but this is really something that can be life-saving when targeted appropriately and used properly.
That is correct. So oftentimes one of the first things they hear after their diagnosis of breast cancer is surgery, chemotherapy, radiation, and people have lots of concerns. And so one thing I really enjoy is sitting down and talking with women and discussing what the role of radiation is in their breast cancer treatment. And for the most part, most women are very grateful and have a good opportunity to talk through that.
All right, and they can do that at IU Health Arnett. Thanks very much, Dr. Matt Orton. We appreciate it.
Thank you for having me.